This is the fibula of the left side. এটা ট্রিক ডিভাইস হলো এই লোয়ার এন্ডে আর্টিকুলার ট্রায়াঙ্গুলার সারফেসের পেছনে থাকে ম্যালিওলার ফোসা। তো এই ম্যালিওলার ফোসাটা ট্রায়াঙ্গুলার সারফেসের পিছনে থাকে, এইটা বরাবর যদি ধরি এটা, দিস ইজ দ্য ফিবুলা অফ দ্য লেফট সাইড। তাহলে এটা একটা টিপিক্যাল লং বোন, এটার আপার লোয়ার এন্ড ইন্টারভেনিং শ্যাফট আছে। তো অ্যানাটমিক্যাল পয়েন্ট হচ্ছে দ্য আপার এন্ড ইজ এক্সপ্যান্ডেড অল দ্য সাইডস and directed upwards. The lower end has a downward projection also known as the lateral malleolus. The medial surface of the lower end contains a triangular articular facet posterior to which lies the malleolar fossa. It is the anatomical position. এখন আপার এন্ডের কথা যদি বলি, আপার এন্ডটা হলো expanded all the sides and it contains a circular articular facet that articulates with the lateral condyle of the tibia and forms a plain variety of synovial joint also known as the superior tibiofibular joint. There are three types of tibiofibular joint: superior, middle and inferior tibiofibular joint. Superior tibiofibular joint is a plain variety of synovial joint, whereas middle and inferior tibiofibular joint is syndesmosis variety of fibrous joint. এখন এটার একটা পোস্টেরো ল্যাটারাল সারফেসে একটা প্রজেকশন আছে, এটার বলে স্টাইলয়েড প্রসেস। এই স্টাইলয়েড প্রসেস প্রোভাইডস দ্য অ্যাটাচমেন্ট টু দ্য ফিবুলার কোল্যাটারাল লিগামেন্ট। এখন হচ্ছে অ্যান্টেরিয়র স্লোপিং সারফেস অফ দ্য ফিবুলার হেড কন্টেন্স দ্য ইনসারশন অফ দ্য বাইসেপস ফিমোরিস মাসেল। এখন হচ্ছে the constricted portion below the head is the neck. Medially it is related to the anterior tibial vessels and laterally it is related to the common peroneal nerve. Fracture of the neck of the fibula হইলে এই নার্ভ ড্যামেজ হলে বা নার্ভে যদি কোনো কম্প্রেশন আসে ডিউ টু দ্য প্লাস্টার অন দ্য ফ্র্যাকচার্ড ফিবুলা, তখন হচ্ছে ইট ক্যান কজ sensory and motor loss to the structure supplied by this nerve, resulting in loss of sensation in the dorsum of the foot as well as foot drop and paralysis of the anterior and lateral compartment of the foot, resulting in loss of eversion and loss of dorsal flexion of the foot, also known as the condition is called foot drop. Okay, এখন হচ্ছে লোয়ার এন্ড। লোয়ার এন্ডটা কি? ইট ইজ expanded side anterior posteriorly and flattened side to side. It contains anterior, posterior, lateral and medial surface. Now, anterior surface is rough and contains the insertion and provides the attachment of the anterior talofibular ligament. Posterior surface contains a groove, malleolar groove. It is related to two ligaments. This is the posterior interosseous tibiofibular ligament and this is the posterior talofibular ligament. This is an articular triangle that is located in the medial aspect of the lower end, and this is the interosseous tibiofibular ligament and this is the anterior tibiofibular ligament. A notch is present at the lower end. It is the calcaneofibular ligament. Now the shaft. It is a typical long ball, contains three surface and three borders in the shaft. তাহলে কি borders আছে? The anterior border, interosseous border. This is the interosseous border, also known as the medial border, and this is the posterior border. So there are three surfaces: the medial, lateral, and posterior surface. This is the medial surface. This is the lateral surface, and this expanded surface is the posterior surface. The posterior surface can be seen as that the posterior surface is divided into two parts in the upper two-third by a median crest. Now medial surface lies in between the anterior and medial borders, also known as the interosseous border. The lateral surface lies in between the anterior and the posterior border, and the posterior surface is extensive and lies between the posterior and the medial border, also known as the interosseous border. Now attachment. Medial surface provides the origin of extensor group of muscles. So upper one fourth, this portion provides the origin of the extensor digitorum longus. The medial 2/4 laterally it provides the origin of the extensor hallucis longus, and the medially it provides the origin of extensor digitorum longus, and lower 1/4 portion of the medial surface provides the origin of the peroneus tertius. This is the lateral surface and provides the attachment of peroneal group of muscles, the lateral compartment of the leg. So this is the upper 1/3, this is the middle 1/3, and this is the lower 1/3. Upper 1/3 provides the origin of peroneus longus, Middle one third anteriorly provides the origin of the peroneus brevis and posteriorly provides the origin of the peroneus longus, and lower one third it provides the origin of the peroneus brevis. This is the posterior surface divided by a median crest, medial to which is the depressed surface and lateral is a convex surface. So in the median crest, medial to which in the depressed surface or in the grooved surface, it provides the origin of the tibialis posterior muscle, and lateral to which in the upper portion it provides the origin of the soleus, and in the lower portion it provides the origin of the flexor hallucis longus. And if we trace the anterior border, it starts from the anterior aspect of the head of the femur. It can be traced downwards and be seen splitting into two lamina, so, and enclosing a triangular surface. This is the anterior border, and now we can see that it splits into two lamina and enclose a triangular surface. The anterior border of this triangular surface provides the attachment of the superior extensor retinaculum, and this posterior border provides the attachment of the superior peroneal retinaculum. In the posterior aspect of the lateral malleolus, we can see this is a groove, and it lodges the tendons of the peroneus longus and the brevis. This lateral surface is subcutaneous and can be felt from outside the body. This is all about fibula. এখন কিছু clinical condition যদি আমি explain করি, তো first of all the fracture is most common in the neck as well as 2 to 5 centimeter distal to the proximal to the distal end of the fibula. So this is the distal end of the lateral malleolus. এর 2 থেকে 5 সেন্টিমিটার প্রক্সিমালে হচ্ছে ফ্র্যাকচার হতে পারে। এখন in the fracture of the neck of the fibula, it can lead to foot drop, loss of eversion of the foot, as well as sensory loss in the dorsum of the foot because it is supplied by the superficial and deep peroneal nerve. Okay, now হচ্ছে surgically হচ্ছে fibula can be used as a bone grafting material as well. Now the ossification centers are 3 in number. The 2 secondary ossification center for the two ends and 1 primary ossification center for the intervening shaft. Fibula is also called the outlaw in case of violating the law of ossification, law of union of ossification. The law of union of ossification states that the secondary ossification center which appears first will unite last with the diaphysis in a developing long bone. So in this case, the secondary ossification center of the lower end appears first, as well as it unites first with the diaphysis as well. So it violates the law of union. So it is also known as the outlaw. This is all about fibula.